Hi, I'm Dr. Julie Steinauer, and today I want to talk to you about a condition called retinitis pigmentosa. Now, before we get into that, I want to discuss how you can connect with our office. If you're local, call us at 618-288-1489. If you're not local, go to our website, visionforlifeworks.com, and you have two choices. You can either click on the schedule a consultation, and that is scheduling a consultation time directly with me, or you can click on the fill out a questionnaire, and that's going to give you some feedback as to what's going on with your vision and maybe how serious it is and should be looked at. Now, retinitis pigmentosa is a unique and rare disease process that occurs to the retina or the back of the eye. It affects the photoreceptors or the cells of the retina, and oftentimes it actually starts in youth, so in like childhood age or teenage years. And the cells that get affected typically tend to start on the outside or the periphery of the retina, and then over time the cells that are affected it creeps in and provides, unfortunately, like a tunnel vision. So the retina itself is damaged over time. And this is, again, it's kind of a rare, maybe genetic disorder or disease, and we don't really know all of the causes or reasons why someone develops it versus someone else, but there does seem to be some genetic components. Now, with retinitis pigmentosa, there traditionally has not been a lot of treatment options that are available to patients. And oftentimes by the time that I see patients in their teens or maybe their early 20s, they have a fairly significant tunnel vision, and it can be pretty debilitating because that tunnel vision can get fairly small. What we do and what our program does for patients who have retinitis pigmentosa is that we stimulate the brain. It also stimulates the retina to be able to process information. And the particular filters that we use for syntonics, which you guys hear me talk about all the time when I do videos, I talk about my syntonics a lot. Okay, we use all kinds of different filters, but there are certain filters that can be used to trigger the photoreceptor cells in the back of the retina, and also to kind of provide nourishment. By nourishment, we mean blood flow and blood supply that goes to the area of retina. Now, let's take something else as an example as to how this works. So when a patient has a stroke, and that particular area of the brain that was affected by the stroke has gone without blood supply and oxygen because some sort of blockage has occurred in a blood vessel, a clot blocked something, blood flow stopped beyond that clot, and the area of the brain is challenged. It's kind of degraded as a result of going without oxygen and blood supply. Depends on how long that occurred. The more severe the symptoms are associated with, the longer the blood clot was kind of like blocking the flow and blocking the chain of the blood flowing to that area to provide it with what it needs to stay healthy and viable as tissue. So if I have someone who's had a stroke and they've got an area of brain tissue that has, for lack of a better word, it's almost been damaged or destroyed as a result of lack of blood flow, again, depending on the severity, then what we do is we use certain filters that increase the blood flow to that area. If you increase the blood flow back to that area, maybe you can kind of get some viable, normal brain activity to happen there again. And so in retinitis pigmentosa, is similar. We're using similar filters that we use for someone who's had a traumatic brain injury or a stroke, and they've had lack of blood flow, lack of oxygen, which damages the brain. And we're saying, okay, well, these cells, these photoreceptors have been damaged because of this condition. What happens if we increase the blood flow into the back of the eye all the way through the retina and perfuse that area with good blood supply and oxygen again, and then kind of electrically trigger those things to, will they kind of turn back on? What happens there? Well, in the case of retinitis pigmentosa, when we're treating it, we actually are able to return some of the visual field that patients lose as a result of that condition. Now, it is dependent upon how severe the condition has progressed to. So if a person is maybe, say, they've lost about 30 to 40% of their visual field versus someone who's lost about 80 to 90% of their visual field, and they're kind of down to really small tunnel vision. Obviously, that particular person, if they get 10 degrees or 10% of their vision back, that's a pretty big significant change. So 10% of improvement there or 20% of improvement can be pretty awesome. We have seen in another kind of something similar here, but in a case that I'm going to talk about next with glaucoma, we're kind of doing the same thing. We're increasing blood flow to the optic nerve, and while damage has occurred that's affected the retina the optic nerve and caused the peripheral field to kind of collapse in someone with glaucoma and retinitis pigmentosa, those cells, those photoreceptor cells that process what you see in the retina have been damaged. We're kind of sparking them to maybe have a little bit more life back into them and helping trigger the brain to be able to bring back some vision. So we do see a difference in those patients in returning some of their peripheral vision. You cannot return it all, typically, and so it does, it is case by case dependent on how severe the condition is. But there is hope and there is treatment for retinitis pigmentosa so that we can help to restore some of the visual field that may have been lost as a result of it. So now if you have questions, since you've seen this video either for yourself or maybe for someone that you know that has it, please feel free to contact our office, particularly if you're local. Call us at 618-288-1489. If you're not local, it doesn't mean that you can't contact us. We just prefer, because of the volume of inquiries that we get every single month, that if you're not local, you go through our website. And you go to the website and do one of two things. Either start by connecting to us via the questionnaire, or schedule a consultation directly with us. As you can imagine, when we have a flow of 250, 300, 400, 500 people every single month trying to connect with our office, I'm only one person. I do have patients to manage. I can't respond to every single inquiry, so I have to respond to the ones that are more serious. And if you're wanting to consult with me directly about your particular case, the best method to do that is schedule a consultation to talk with me directly. Now again, you can go to our website at visionforlifeworks.com in order to do either of those things, the questionnaire or the consultation. And if you like this video, hit the like button, pass it on to someone, obviously if you feel like it could be beneficial. And if you've not done so already, subscribe so that you get all of our video content. Thank you.